All right, parents, I've had enough. Every day in practice, I take a case history of either an older child who's had too many rounds of antibiotics as an infant and young child, or we begin care with another infant whose nervous system, their gut, their immune system, development are an absolute mess due to antibiotics. Now, for about 2 decades now, the research has been super clear that pediatricians continue to overuse antibiotics for common things like ear infections or respiratory infections in kids. And the short-term side effects are no good, but the long-term side effects are actually even worse and bigger problems for our kids. Now, my name is Dr. Eric, and I am one of the pediatric chiropractors here at ADIO Chiropractic here in the Middleton and Madison area. Now, we focus on helping families get to the root cause of what may be impacting them from really just living their best quality life and having their best expression of life. In this video is going to be for moms and dads who do not want to really give their child another round of antibiotics or have yet and are looking for natural options and solutions that they can use for ear infections or other upper respiratory infections other than antibiotics and other medication. In this video, we're going to break down for you the long-term side effects of antibiotics, including development of antibiotic resistance, chronic health conditions, and autoimmune disorders, and disruption of the gut microbiome. Now, please, before I go any further, share this video with other moms and parents who you know need to hear this message. We are tired of seeing our kids go through this struggle, knowing that there are other things and safer options out there for them. Just like Isabella, who was dealing with constant ear infections, and after so many rounds of antibiotics, their pediatrician said the only thing that can help is surgery, so actually putting tubes in. But mom didn't want that for her daughter, so she found us through another person, and since starting care for Isabella, hasn't had a single another ear infection since. That is just amazing. And let's get into the science behind antibiotics. So the first thing we look to do is empower and educate our parents to be strong advocates for their children's health, especially when it comes to understanding antibiotics are not always necessary or effective for treating certain infections, such as viral illnesses or mild ear infections. Now, the overuse of inappropriate use of antibiotics can actually lead to the development of what we call antibiotic-resistant bacteria, which can actually be very difficult or impossible to treat in the future. Now, the main things about antibiotics that they really create havoc and wreck the kids' long-term health by weakening and suppression of their immune system, by disruption of their gut microbiome, the disruption of their neurotransmitters and their gut-brain connection, and then also the development of antibiotic resistance that I just talked about. Now, the real root problem with the use of antibiotics for things such as ear infections or upper respiratory infections is that they do not address the root cause, which really is a poor plumbing and bad drainage problem and an imbalance with their neuroimmune system. Now, the original factors that would trigger the poor drainage and the neuroimmune function in kids generally are birth interventions and trauma during birth, especially things like forceps or vacuum or C-section where they pull on the head. there's a lot of research between C-sections and respiratory and autoimmune challenges later in life for kids due to not only the disruption of the gut microbiome, but also the upper cervical subluxation and the physical tension that this then disrupts the function of what we call the vagus nerve and our autonomic nervous system regulation of our immune system and the inflammation. So as a neurologically focused pediatric chiropractor, our goal, our foremost priority is to get to the root cause of common ear and respiratory infections and serve as the first stop and the drug-free natural solution for families so that they do not have to resort to antibiotics. So to close this video, first, please ask any questions or leave a comment down below or send us a direct message. Second, please share this video with other parents, other families, Facebook groups who need to hear this information. Third, be sure to head over to our website and check out our full article on the side effects of antibiotics, as well as other articles and PDF guides that go through all sorts of natural remedies and options you can use instead.